So the headline is exposure to antidepressant medication increase the risk of dementia. And does that mean antidepressants cause dementia? Or does that mean somehow depression is one of the causes of dementia?
Meet Dr. Daniel Amen, a renowned psychiatrist and leading expert in brain health who has significantly shaped the medical field. As the founder of the Change Your Brain Foundation, BrainMD, and Amen University, Dr. Amen has dedicated his career to advancing our understanding of brain function and mental wellness. His pioneering research on post-traumatic stress disorder and traumatic brain injury was recognized by Discover magazine as one of the top 100 science stories of 2015. In this video, Dr. Amen will discuss two lesser-known medications that can contribute to the onset and progression of dementia. But that's not all. Dr. Daniel will also reveal some surprising lifestyle habits that may contribute to dementia and how to prevent them. So make sure you watch until the end so you don't miss any valuable information. Now let's dive into the first category of medications linked to dementia, according to Dr. Amen, antidepressants.
And then they looked, was there an association between antidepressant medication and the incidence of dementia? And they did all sorts of statistical analyses. And in the primary analysis, the risk of dementia for the group exposed to antidepressants compared to those who had never been exposed was 4 times the risk. And then, they adjusted for all sorts of things, and it was anywhere from double the risk to 5.5 times the risk.
When it comes to treating depression, anxiety, and other mental health conditions, antidepressants are the most commonly used medication. Antidepressants work by charging the brain's chemistry to aid in improving mood and reducing symptoms of depression. However, recent studies from the National Institute of Health reveal a shocking connection between antidepressant usage and an increased dementia risk. Another groundbreaking study from Israel, as described by Dr. Daniel Amen, showed that antidepressant exposure increased dementia risk by 2 to 5.5 times, even after adjusting for various factors. Here's how antidepressants might lead to dementia. It all begins with the way they change brain chemistry. Antidepressants work by adjusting levels of chemicals like serotonin, dopamine, and norepinephrine. While this can boost mood, using them for a long time might upset the brain's natural balance, potentially affecting memory and thinking skills. One major concern is how certain antidepressants interfere with acetylcholine, a brain chemical vital for memory. Some antidepressants block acetylcholine, which can lead to memory problems and, over time, may increase the risk of dementia. Gradually, this interference with brain chemistry can lead to issues with memory and thinking, increasing the likelihood of developing dementia. For people already at risk, low levels of acetylcholine, essential for memory, make the effects of these anticholinergic antidepressants even more serious. Antidepressants may also impact dementia risk by affecting blood vessel health. Some studies suggest that certain antidepressants may cause inflammation or narrow blood vessels, reducing blood flow to the brain. This drop in blood flow can lead to cognitive decline, a key symptom of dementia, since neurons in the brain depend on a constant supply of oxygen and nutrients. Any break in this flow can have long-lasting effects on thinking and memory. In addition, certain antidepressants have been found to have neurotoxic effects, which can harm brain cells over time. This damage can disrupt how neurons work, leading to memory problems and increasing the risk of dementia. Neurons are the essential building blocks of the brain's complex communication system, so any harm can seriously affect overall brain function. As the saying goes, prevention is better than cure, so Dr. Amen will reveal some natural alternatives to antidepressants.
So, what do you do? And somebody asked, well, what's the best antidepressant? I get asked that all the time. And I'm like, well, first, are we doing the right things for our brain? Are you eating right? Lots of vegetables, some fruit, healthy protein, lots of healthy fat. Are you eating right? Are you exercising? Omega-3 fatty acids.
Dr. Amen emphasizes the importance of adopting a holistic approach to mental health, especially when it comes to antidepressants and dementia risk. Rather than relying solely on medication, he recommends exploring natural alternatives that promote brain health. So, what are these natural solutions? Let's start with the basics. As Dr. Amen suggests, the first step to promoting optimal brain function is maintaining a balanced diet that includes plenty of vegetables, fruits, and healthy proteins and fats. This nourishing approach provides essential nutrients that our brains need to thrive and lays a strong foundation for mental well-being. Exercise is also crucial for maintaining mental health. Regular physical activity has been shown to boost mood and reduce symptoms of depression, acting as a powerful natural antidepressant. Additionally, exercise increases blood flow to the brain, which supports cognitive function and overall brain health. But these benefits don't stop there. Eating foods rich in omega-3 fatty acids is another effective way to support a healthy brain. These essential fats, found in foods like fatty fish, flax seeds, and walnuts, are linked to better mood and reduced inflammation, which can contribute to depression and dementia. In addition to diet and exercise, focusing on stress management and practicing mindfulness can greatly enhance mental well-being. Techniques like meditation, deep breathing, and yoga have been shown to reduce symptoms of depression and anxiety, promoting a balanced and resilient mind. Now, let's discuss the second drug on Dr. Amen's list. You might be surprised by what it is, as many of us consume it daily. Before we continue, please note that this content is for informational purposes only and is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider before making any changes to your diet or your daily routine.
Low blood flow is the #1 brain imaging predictor of Alzheimer's disease.
Okay.
How do you get low blood flow? Caffeine.
Oh, shit.
No doubt, many of us can't do without our morning cup of joe or tea. But did you know that caffeine, the most widely consumed psychoactive drug in the world, might have a downside? Let's explore how. Caffeine is a central nervous system stimulant that temporarily blocks the effects of adenosine, a neurotransmitter that helps relax the brain and makes us feel sleepy. By inhibiting adenosine, caffeine keeps us awake and alert, giving us the energy boost we seek. However, this disruption to our natural sleep-wake cycle can have consequences. Dr. Daniel points out that caffeine can constrict blood flow to the brain by up to 30%, which may affect overall brain health.
I think people refer to caffeine often as like this miracle drug that comes with no cost. But you're the first one through my research that seems to be very clear that caffeine does have a significant cost.
It's a drug. It's the most common drug. It's addictive. I mean, a little bit's fine, but more than a little bit is not fine. It increases cortisol. You don't want to increase cortisol. It puts fat around your belly. It shrinks your hippocampus. But, the reason I started really paying attention to it is on SPECT, the study I do, which is a blood flow study, it constricts blood flow 30%.
Adequate blood flow is important for delivering oxygen and nutrients to our brain cells, which is essential for optimal cognitive function. However, reduced blood flow to the brain is a significant contributor to Alzheimer's disease. Even more concerning is caffeine's addictive nature. Many people turn to caffeine to fight sleep deprivation, creating a vicious cycle that disrupts sleep patterns and increases the need for more caffeine. This reliance not only affects sleep quality, but can also lead to higher levels of cortisol, the stress hormone. Elevated cortisol is linked to fat storage around the belly and can shrink the hippocampus, which is an important part of the brain responsible for learning and memory. In fact, research from Harvard University indicates that chronic caffeine consumption is linked to a 53% increased risk of cognitive decline and dementia. This is because caffeine causes the release of excitatory brain chemicals like glutamate, which can make neurons overly active. This overactivity can lead to oxidative stress and inflammation, both of which play a big role in neurodegenerative diseases like Alzheimer's and dementia. So if you're looking for natural alternatives to coffee that support brain health and might help prevent dementia, here are some options to consider. Herbal teas. Teas like ginkgo biloba, ashwagandha, and green tea contain potent antioxidants that protect brain cells from oxidative stress and inflammation. These herbal teas also improve blood flow to the brain, enhancing cognition and lowering the risk of dementia. Adaptogen drinks. Adaptogens like reishi mushrooms, rhodiola rosea, and cordyceps are known for their ability to reduce stress, improve mood, and boost brain function. You can create a delicious adaptogen elixir by blending these powerful ingredients into a warm, nourishing drink. Golden milk. This creamy, comforting beverage is made with turmeric, a spice known for its potent anti-inflammatory and antioxidant properties. By reducing inflammation and protecting brain cells from damage, golden milk can help stave off cognitive decline and dementia. Coconut water. Did you know that coconut water is rich in electrolytes and natural sugars? This makes it a refreshing and hydrating alternative to caffeine. It offers a natural energy boost without the jitters or crashes that often come with drinking coffee. Cacao drinks. Raw cacao is another excellent option, packed with flavonols, a type of antioxidant that enhances blood flow to the brain and boosts cognitive function. Consider enjoying a comforting cup of hot cocoa made with raw cacao powder, a natural sweetener like honey or maple syrup, and your choice of milk for a delicious brain-boosting treat. Remember to also prioritize a balanced diet, regular exercise, and stress management techniques to support overall brain health and reduce the risk of dementia. Moving on, Dr. Amen will be revealing 2 surprising lifestyle habits that also contribute to the development and progression of dementia. But before we proceed, if you're looking to dive deeper into how lifestyle and diet can protect your cognitive health and boost your overall health, be sure to subscribe to the QuickTime newsletter linked below. Each week, we share expert-backed tips, delicious recipes, and actionable steps to help you live longer and feel your best, delivered right to your inbox. The first habit that can contribute to the development and progression of dementia, according to Dr. Amen, is a lack of learning.
You want to prematurely age your brain? Drop out of school. Do not engage in new learning. I mean, you doing this podcast, you're always learning new things, which is great for you. But the lack of, when you learn something new, your brain makes a new connection. When you stop learning or you start doing the same thing over and over again, your brain starts to disconnect itself. Being in a job that does not require new learning is a risk factor for dementia.
The human brain is an incredibly adaptive organ that thrives on new experiences and learning opportunities. However, when we stop challenging ourselves and fall into a routine of repetition, our brain's cognitive reserve diminishes, potentially paving the way for the development and progression of dementia. Dr. Amen highlights the consequences of disengaging from new learning experiences, emphasizing that leaving school or remaining in a job without growth or new learning opportunities can be risk factors for dementia. But why is this the case? Well, the answer lies in our brain's remarkable ability to adapt and reorganize itself in response to new experiences, a process known as neuroplasticity. Here's a fun fact. Every time we learn something new, our brain creates new connections between neurons, strengthening neural networks and improving cognitive function. However, when we stop learning and start repeating the same tasks, the brain begins to cut away those unused connections. This process can lead to cognitive decline and an increased risk of dementia. According to research, engaging in cognitively stimulating activities throughout life can help stave off cognitive decline and reduce the risk of dementia. The study also found that older adults who participated in mentally stimulating activities, such as reading, playing games, or attending cultural events, exhibited a lower risk of developing dementia compared to their less engaged counterparts. So, what can you do to maintain an active and engaged mind to help prevent dementia? Here are 4 strategies to try. Embrace lifelong learning. Enroll in online courses, attend workshops, or join a book club to continuously expose your brain to new ideas and concepts. Challenge yourself. Engage in activities that push the boundaries of your comfort zone, such as learning a new language, trying a new hobby, or exploring unfamiliar places. Stay socially active. Maintain meaningful connections with friends and family, and seek out opportunities to meet new people. Social engagement helps keep your brain stimulated and promotes overall cognitive health. Play brain games. Incorporate brain-boosting activities like crossword puzzles, Sudoku, or logic games into your daily routine to strengthen neural connections and improve cognitive function. The second habit that contributes to dementia is loneliness. Now, let's pay close attention to what Dr. Amen has to say about this.
Being lonely is a risk factor for dementia. So be an ass, and you're more likely to hurt your brain. At my workplace, we have the no asshole rule. So there's a book by a Stanford professor called The No Asshole Rule. Love that book. And the no asshole rule as a CEO starts with me. So I don't get to be one, but I'm not tolerating anybody who has asshole behavior at work. And if you're not an asshole, you're less likely to be lonely. And loneliness is terrible for brain function.
Loneliness is a widespread issue that affects people of all ages and backgrounds, and its effect on mental health is well documented. However, recent research reveals an even more concerning consequence: the link between loneliness and the development of dementia. As Dr. Amen emphasizes, loneliness can be a significant risk factor for dementia, and here's how it works. Humans are naturally social creatures, which means our brains are wired for connection. Positive social interactions stimulate the release of oxytocin, a hormone that not only promotes feelings of happiness and well-being, but also plays a vital role in memory and cognitive function. In contrast, loneliness triggers a stress response, leading to increased cortisol levels that can harm brain health over time. A groundbreaking study published in the Florida State University News revealed that loneliness was associated with a 31% increased risk of dementia. This finding aligns with Dr. Amen's assertion that prioritizing healthy social connections is essential for maintaining optimal brain function and reducing the likelihood of cognitive decline. By creating an environment that encourages empathy, understanding, and mutual respect, we can combat loneliness and nurture a sense of belonging, which is vital for maintaining cognitive health. So, how can we prioritize social connections and minimize the risk of loneliness-induced dementia? Here are 3 strategies to consider. Stay connected with friends and family. Regularly reaching out to loved ones, scheduling virtual or in-person meetups, and maintaining meaningful relationships can help alleviate feelings of loneliness and promote cognitive resilience. Engage in social activities. Joining clubs, volunteering, or participating in group exercise classes can provide opportunities to forge new friendships and build a supportive social network. Be kind and compassionate. Extending kindness and compassion to others, whether at work or in our personal lives, can equally create a sense of belonging and foster stronger social bonds. Dementia is a real concern, but by avoiding the contributing factors discussed in this video, you can lower your risk of cognitive decline. Remember, genetics may load the gun, but it's your lifestyle that pulls the trigger. So, avoid foods and habits that increase your risk of developing dementia. And if you want to learn more about dementia, click on the video showing on your screen right now to discover the 9 deadly signs of dementia that Dr. Daniel Amen suggests we shouldn't overlook. See you there.